This 6-minute video was created with the goal of achieving a high score in your exams. Certain types of breast cancer are influenced by hormones such as estrogen. These cancers have receptors that bind to estrogen, promoting their growth. Treatments that prevent these hormones from attaching to the receptors are known as hormone or endocrine therapy.
Question. Please list 3 ways to block this pathway.
The first method is to block the receptors. The second method is to inhibit the synthesis of estrogen. The third method is to inhibit the secretion of estrogen. Estrogen is produced in the ovaries. By controlling the commands from upstream, we suppress the secretion of estrogen.
Question. Please explain the application of each method.
Drugs that block receptors have different applications, depending on their type, so I will explain later. Inhibiting synthesis is applicable to postmenopausal patients. After menopause, when estrogen levels decrease, synthesis is stimulated. By blocking this pathway, we inhibit the postmenopausal promotion of estrogen synthesis. On the other hand, suppression of estrogen secretion is applicable to premenopausal patients. Now, let's take a closer look at each pathway. 1. Receptor. The method to inhibit estrogen and estrogen receptor signaling is using selective estrogen receptor modulators.
Question. What is a receptor modulator?
A receptor modulator, or receptor ligand, is a general term for a substance that binds to and regulates the activity of chemical receptors. It acts like the substance on some tissues, but blocks the effect of the substance on other tissues. Its activity will be influenced by the relative levels of expression of the coregulator proteins, including corepressors and coactivators, that are expressed in different target cells. Selective estrogen receptor modulators are versatile medications that serve multiple purposes. They prevent estrogen from binding to breast cancer cells, thereby inhibiting cell multiplication. Additionally, they mimic estrogen in bones, increasing estrogen levels and protecting against osteoporosis. Tamoxifen and raloxifene work as an antagonist at breast and uterus. It works as an agonist at bone. Tamoxifen is applicable to both premenopausal and postmenopausal female. Tamoxifen is also applicable to male breast cancer. Raloxifene is prescribed to treat osteoporosis in postmenopausal female and to reduce the risk of invasive breast cancer in this group. Both of them have hot flashes as side effects. It's important to be careful about the risk of thromboembolic events, especially for people who smoke. A side effect of tamoxifen that should be noted is endometrial cancer. 2. Aromatase inhibitors. The method to inhibit estrogen synthesis is using aromatase inhibitors.
Question. Let's now review the pathway of estrogen synthesis in the ovaries.
Luteinizing hormone, LH, and follicle-stimulating hormone, FSH, are secreted by the gonadotrophin cells in the adenohypophysis, also called anterior pituitary. In women, LH triggers the creation of steroid hormones from the ovaries. Aromatase is an enzyme that converts androgens, like testosterone, into estrogens, such as 17-beta-estradiol. It is also a highly effective target for treating endocrine-responsive breast cancer. Commonly used medications include anastrozole, letrozole, and exemestane.
Question. What kind of patients are indicated for aromatase inhibitors?
Estrogen receptor-positive postmenopausal breast cancer patients are indicated for this treatment. 3. Control estrogen secretion. For premenopausal women with breast cancer, another method is inhibiting ovarian function to prevent hormone production. The medication used for this treatment is the LHRH agonist. Before discussing agonists, let's confirm the process by which LHRH secretes estrogen. Luteinizing hormone-releasing hormone, also called gonadotropin-releasing hormone, is made by the hypothalamus. LHRH causes the anterior pituitary gland to make and secrete the hormones luteinizing hormone, LH, and follicle-stimulating hormone, FSH. In women, they cause the ovaries to make estrogen and progesterone.
Wait a minute. Doesn't LHRH agonist stimulate estrogen secretion?
That's right. LHRH stimulates estrogen secretion. However, there is a key point in this treatment, which is to administer it repeatedly. Continuous treatment with LHRH agonists causes a decrease in the number of LHRH receptors and an uncoupling of the LHRH signal transduction mechanism. This results in a desensitization of gonadotrophs and a marked reduction in the secretion of bioactive LH and FSH. LHRH agonists are a well-established treatment for sex steroid-dependent cancers such as breast cancer and prostatic cancer. Commonly used medications include goserelin and leuprolide. LHRH stands for gonadotropin-releasing hormone or luteinizing hormone-releasing hormone. So, you can remember the names of medications by their initials.
Question. What patients are eligible for LHRH agonist therapy?
LHRH agonist therapy is indicated for premenopausal breast cancer patients.
Thank you for watching. If you liked the video, please hit the like button. If you want to see more videos, hit the subscribe button.